Bringing your baby home is a moment filled with joy. It is a moment you have waited for. This new chapter is beautiful, but it is also a time of big changes for you and your baby. This time after birth is called the postpartum period. It usually lasts for about 6 weeks. During this time, your body is healing. Your emotions are shifting. You are learning all about your new little one. It is a period of adjustment for everyone in the family. Thinking about these first 6 weeks as a special protected time can help you prepare for what is ahead. It is a time for rest. It is a time for healing. It is a time for bonding. The needs of a new mother and a newborn are simple but so important. You need rest to recover from birth. You need good food to refuel your body. You need support to help you feel held and cared for. Your baby needs warmth. Your baby needs nourishment. Your baby needs to feel safe. Your baby needs to feel loved. Skin-to-skin contact is a wonderful way to meet these needs. It helps regulate your baby's breathing and temperature. It also helps you bond deeply. Remember that your only jobs right now are to rest and to get to know your baby. Everything else can wait. Your body has done an amazing thing. It grew and birthed a new life. Now, it needs time to heal. One of the first things you will notice is your uterus shrinking. As it returns to its pre-pregnancy size, you may feel cramps. These are sometimes called after pains. You might notice them more when you are breastfeeding. This is because breastfeeding releases hormones that help the uterus contract. A warm heating pad on your lower belly can bring comfort. Your doctor can also recommend safe pain relief if you need it. You will also experience vaginal bleeding, which doctors call lochia. This is your body clearing out the lining of the uterus. It is completely normal and can last for 4 to 6 weeks. The flow will change over time. At first, it will be bright red and heavy, like a period. Then, it will gradually become lighter. It will turn pink, brown. Finally, a yellowish-white color. It is important to use sanitary pads. Do not use tampons. This helps prevent infection. Change your pad every few hours to stay clean and comfortable. Your breasts will also go through big changes, especially if you choose to breastfeed. A few days after birth, your milk will come in. Your breasts might feel very full, firm, even sore. This is called engorgement. Rest is perhaps the most important part of your physical recovery. If you had a vaginal birth, you may have soreness in the area between your vagina and anus, called the perineum. This area may have stretched or even torn during birth. It might feel swollen and tender. For the first 24 to 48 hours, using ice packs can be very helpful. You can wrap a soft cloth around an ice pack and place it on the area for 15 minutes at a time. After the first couple of days, warm sitz baths can feel very soothing. You can do this in a shallow tub of warm water or with a special basin that fits over the toilet. This gentle warmth can promote healing and ease discomfort. Your hospital will likely give you a small squirt bottle, often called a peri bottle. Fill it with warm water each time you use the toilet. After you urinate, gently squirt the warm water over the area from front to back. Then, gently pat the area dry with a clean cloth or toilet paper. Do not rub, as this can irritate the sensitive skin. Keeping the area clean helps prevent infection. When you feel ready, you can start doing gentle Kegel exercises. These help strengthen your pelvic floor muscles, which support your bladder and uterus. If you had a cesarean section or C-section, you are recovering from major surgery. Your focus will be on caring for your incision. It is important to keep the area clean and dry to help it heal well. You can usually shower and let the warm, soapy water run over the incision. Then, gently pat it dry with a clean towel. Your doctor will tell you what to look for. Watch for any signs of infection, such as increased redness, swelling, or fluid leaking from the cut. The weeks after birth are an emotional time. Your hormones are changing dramatically. The levels of estrogen progesterone that were high during pregnancy drop suddenly. This hormonal shift can feel like a roller coaster. Many new mothers experience something called the baby blues. You might feel weepy, anxious, overwhelmed for no clear reason. You might find yourself crying 1 minute and feeling fine the next. This is very common. It usually starts a few days after birth and goes away on its own within about 2 weeks. Knowing that this is normal can help you feel less alone. It is important to be gentle with yourself during this time. Your life has just changed in a huge way. You are tired. You are learning a new role. It is okay to feel all the feelings. Talk to your partner friend, another new mother, about what you are experiencing. Caring for a newborn is a journey of learning and love. One of the first things you will focus on is feeding, breastfeeding, formula feeding. Your baby will eat often. Newborns have tiny stomachs, need to refuel every 2 to 3 hours. If breastfeeding, plan to feed on demand. Feed whenever they show hunger cues. Rooting, turning their head and opening their mouth, making sucking motions, bringing their hands to their mouth. Crying is a late sign of hunger. A typical newborn will breastfeed 8 to 12 times in a 24-hour period. A good way to know if your baby is getting enough milk is to watch their diapers. After the first few days, you should see about 6 to 8 wet diapers a day. Their stools will also change. The first few will be black and sticky, meconium. Then they transition to a greenish brown. Finally to a seedy, mustard yellow if you are breastfeeding. Formula-fed babies may have fewer, more formed stools. It is also normal for babies to lose a little weight in the first week. They should be back to their birth weight by about 2 weeks of age. Your pediatrician will track your baby's weight to make sure they are growing well. Newborns sleep a lot, but in short bursts. They may sleep for 16 hours or more in a day, but they will wake up every few hours to eat. It is very important to create a safe sleep space for your baby. Always place your baby on their back to sleep for every sleep. The crib or bassinet should have a firm mattress with a fitted sheet. As you settle in at home, you will start to find a gentle rhythm with your baby. One of the best things you can do is skin-to-skin contact. Holding your baby bare chest to bare chest is incredibly powerful. It helps regulate your baby's heart rate. It helps regulate your baby's temperature. It calms them when they are fussy. It can boost your milk supply. It can reduce your stress. You can do this every day at home. Find a comfortable chair. Lay your baby on your chest. Cover both of you with a warm blanket. It is a simple, loving way to connect. Accepting help is key in these first weeks. When friends and family offer to help, say yes. Let them bring you a meal. Let them fold a load of laundry. Let them hold the baby while you shower or nap. Give helpers a specific small task. You do not have to do everything yourself. Lean on your village to heal and bond. Know when to call the doctor. For yourself, fever over 100.4 degrees, 38 degrees. Heavy vaginal bleeding that soaks more than 1 pad an hour. Pain that gets worse instead of better. If your C-section incision looks infected. Signs of postpartum depression. For your baby, a fever. Trust your instincts. Call if something feels wrong.